Activities of Daily Living, narrated by Shiver. Activities of daily living, otherwise known as the ADLs, are activities that are performed during a normal day and include ambulation, eating, dressing, bathing, and grooming. There is a scientific knowledge base behind ADLs. Good physical hygiene is necessary for a patient's comfort, their safety, and their overall well-being. Often ill patients will require assistance with personal hygiene. And there are several factors that influence a patient's hygiene practices. Risk factors for hygiene problems could include oral issues or skin issues or even foot or eye care issues. And we're going to talk about each one of these in a little more detail. The skin. The skin's function is to protect us. We have secretions that help keep the skin moist. It also is responsible for excretions of waste, temperature regulation, and also sensation. And there are three critical layers to our skin, which include the epidermis, the dermis, and the subcutaneous layer. Anytime there's breakdown in any of these layers, it definitely puts the patient at risk for infection. So it is critical that we do monitor this patient's skin condition, and if they're unable to maybe turn themselves, that we turn them every 2 hours, or if they're unable to keep their skin clean, to make sure we keep it dry and clean for them. Your feet and nails require special attention. The normal nail should be transparent and smooth and convex with a pink nail bed and white tip. Obviously, if the nail bed is blue or it's pale, this may be an indicator that the patient has a problem with oxygenation, or they could be anemic. We also want to monitor for changes in shape, thickness, and curvature that may occur, that may too be indicative of hypoxia or even a nutritional deficit. The goal is to prevent infection, odor, and injury. Our oral cavity and teeth, hair, eyes, ears, and nose. With our mucous membranes, we expect our oral mucosa or the buccal mucosa to be light pink and moist. Obviously, if it is pale in color, that's a great indicator that the patient may be anemic or having blood loss. We look at hair growth and distribution because this can indicate the general health status of the patient. Often patients who have peripheral vascular disorders or venous stasis ulcers, you'll see decreased hair production on the legs. It may not be as obvious on the females, but on the males, you'll see shiny skin with no hair. Well, that's a great indicator that there may be a vascular issue. Nursing knowledge base, we need to individualize the care or the ADLs for each patient. The needs are going to be different from patient to patient. Hygiene is never routine, so we shouldn't get complacent about our hygiene practices. During our hygiene, it's a great time to assess our physical status of the patient, and also we can assess the patient's limitations. What are they capable of doing? We also need to assess the patient's readiness to learn and also participate. Make sure we're providing privacy and foster physical well-being for the patient. Privacy is critical, though. Some different factors that may influence a patient's hygiene practices: their body image. How does the patient feel about their self? Or what are their social practices? What are their social norms? What about their socioeconomic status? Sometimes we don't consider that. Maybe if a patient doesn't have good hygiene practices, we just consider them as being maybe lazy. But it could be maybe they don't have the resources. Maybe they don't have running water or access to the resources they need to have good hygiene. We also need to consider cultural variables. Different cultures have different practices when it comes to hygiene. What are the patient's personal preferences? How often do they perform hygiene? And are there any preferred products that they use? Also, what's their physical condition? Are they capable physically of performing good hygiene, or have they lost some dexterity? And do they understand the importance of good hygiene? So sometimes patient teaching is huge when it comes to hygiene issues. We also need to consider the developmental changes. Age influences the condition of the skin and type of hygiene that will be required. And I've got the different developmental needs from the neonate to the elderly listed here. The neonates are going to have very immature and vulnerable skin. Toddlers, fortunately, have a little bit tougher skin. They're more at risk for injury. With the adolescents, we see increased oil, which in turn leads to more acne. Adults will see more elastic, well-hydrated skin, usually smooth. And then as we get older, the skin is thinner and loses elasticity. And moisture has decreased the sweat gland activity. With the elderly and the neonates, very high risk for skin tears. Bathing and skin care, ideally we'd like to get our patients in the tub or the shower, but safety may be an issue and that may not be appropriate for the patient. In the tub or shower, it's going to be more thorough. We're going to have a better job done, and the patient can be more independent. In a complete bed bath, this does require the nurse to provide total hygienic care. With a partial bed bath, this is where we only bathe the parts that would cause discomfort or odor if unbathed. During any bed bath, as the nurse, we can use inspection, palpation, or touch to note color changes, turgor, texture. Bed baths are actually an excellent time to do a good assessment on your patient. It is critical that we do check all skin surfaces. With perineal care, the females, this involves the vulva from the rectum, and it's important that we teach patients and also that we clean from front to back or from pubis to anus. Between the scrotum and the anus is where we would focus perineal care with the male. Folks most in need would be those with secretions or those that have Foley catheters. It is critical that if a patient has an indwelling catheter that we do good perineal care to prevent infections. Following rectal surgery or after childbirth, too, are very important times that we have good perineal care. Watch for discharge, skin irritation, or odors. Sometimes patients have a lot of skin folds in the perineal area, so we have to make sure that the patient stays as dry as possible. Good care prevents skin irritation and breakdown. With foot and nail care, the foot assessment and care should be done daily, and this is critical, especially for diabetic patients who have decreased sensation to their lower extremities. Make sure you clean and dry the feet thoroughly. A general rule is nurses do not trim nails. Trimming nails puts the patient at risk for infection, and the overall rule is you just do not trim nails. If nails need to be trimmed, then the physician will have to get an order, and a lot of times the physician would actually do that. When I say physician, I'm referring to a podiatrist if the nails are really thick or disfigured. We need to inspect for lesions, dryness, signs of infection. Patients with diabetes or peripheral vascular disease are going to be at very high risk for impaired circulation. You never soak a diabetic patient's feet, because where there's moisture, there's going to be bacteria. So do not soak the diabetic patient's feet. With oral hygiene, this involves cleanliness, comfort, moisturizing the mouth. If patients are unconscious, we can use lemon glycerin swabs to help moisten the mouth and moisten the lips and clean any secretions out that may be in there. Flossing and brushing is very important. Denture care is also very important. Assess for dental caries, sores, redness, breath odor. One of the primary sources for infection can actually be poor dental hygiene. If bacteria is in the mouth, well, then that's an easy route to get into the body or the system and cause some major systemic infections. Hair care. We need to assess the scalp and the hair during the AM. It may include brushing or combing the hair. Sometimes we even will shampoo the patient's hair if they've been in the hospital an extended period of time. And there are products that have no rinse, or the shampoo requires no rinse which is actually nice. As far as shaving goes, do you use a regular versus electric razor? Well, it depends on the circumstances. You want to consider what the patient's normal routine would be, and you never shave off a patient's mustache or beard without their consent. If a patient is on a blood thinner, then you may want to use an electric razor if possible. If the patient is on the psych unit and maybe is in danger of hurting themselves, you definitely would want an electric razor, or maybe a regular razor in the presence of one of the healthcare personnel. So it depends on the circumstance. Females may need assistance with shaving under their arms or legs. Eye and ear care, we need to clean the external eyes. In doing that, you wash from the inner to the outer canthus first. And in general, when you're doing a bath, you're going to start with the eyes first and always end with the perineum area. Eyeglasses may be an issue, or you may actually have to clean eyeglasses as well. We need to assess for contact lenses, especially if the patient is unconscious. Look for contact lenses because they could actually cause ulcerations to the eyes if they're not removed. Clean the outer ear only. Never put Q-tips into the inner ear. At the end of the bath, massage can actually be used to produce physical and mental relaxation, reduce pain, and actually calm the patient. In the patient's room environment, we need to attempt to make the patient's room as comfortable as possible. We also need to keep the room neat and organized so it contributes to the patient's sense of well-being. In the patient's room environment, sometimes we go in the patient's room and it's very hot or it's very cold. Well, we need to set the temperature to what the patient needs. I've seen nurses in the past that will actually adjust the temperature to their personal taste. Well, we need to consider the patient. That is the patient's environment. Patient's room should be well ventilated, decreased noise, no odors. It should be clean. And visitors, you might actually have to step in as the nurse and help regulate the traffic control. If the patient requests no visitors, then we need to honor that request. The room equipment, most rooms will have an overbed table. We need to clean before using meals and try not to place bedpans and urinals and things of that nature or our supplies on the overbed table, especially if there's a meal present. There's usually a bedside stand. We can put the patient's belongings, some that they may need throughout the day, in the bedside stand, and there'll be chairs and overhead lamps in the room as well. Hospital beds are designed for safety, and they're designed for patients and for changing positions. Make sure you know how your hospital beds work. Identify wheel locks and how to work the side rails, the footboards, and all the electrical controls that come along on the hospital beds. The call light should be within reach, and CLWR is a common abbreviation we use for call light within reach. Side rails should be up. This helps the patient turn in the bed and change positions. But keep in mind, if you put all the side rails up, then that actually is considered a form of restraint and requires an order from the physician. The wheels need to always be locked, and the bed needs to be in lowest position when unattended. Please, when you're doing a procedure on the patient, though, raise the bed up, because it facilitates your comfort and makes it easier to work with the patient. On this slide, I've included some different bed positions. You'll need to review each of these positions. Fowlers is very common. Semi-Fowlers, also very common. They both will help promote lung expansion. We use this to decrease the risk for aspiration. Trendelenburg you may see used for patients that have a low blood pressure to facilitate the blood flow back to the brain. Reverse Trendelenburg is when you have the head of the bed entirely is elevated, and this also helps prevent reflux or aspiration. And then there's good old flat. The bed should remain clean, comfortable, dry, and free of wrinkles. Please keep in mind when there's moisture and wrinkles, that can increase your risk for skin breakdown. Make the bed after the bath or as needed, and use good body mechanics. Again, elevate that bed to the proper height if you're going to be working at the bedside. But if you walk away, please put a side rail up and return that bed to the lowest position. On your own time, please review the techniques for bathing and perineal care, performing nail and foot care, providing oral hygiene, which includes cleaning dentures. Also look at how you would clean an unconscious patient's mouth. Review making an occupied bed, techniques for massage, and care of the eye and ear prosthesis.